Hi, everybody. I'm Wendy Murdoch, and this is Webinars with Wendy. We are continuing our subject about the state of the equine veterinary practice industry with Dr. Madalyn Ward, because it is so important to horse owners. And tonight we're actually going to talk about steps that you can do as horse owners. So welcome, Madalyn. Thank you so much for coming back. I really appreciate you spending more time with us on this incredibly important topic.
No, very happy to do it. And I think maybe it's just as well we got cut off, because I think we could have talked for 3 or 4 more hours. And this also has given us a chance to, get some of the questions that were on the chat. So we make sure we get people's concerns addressed, because this is a topic that's going to be ongoing. And I'll just briefly, I graduated from Texas A&M in 1980, a whole different world. And as I mentioned on the first call, I came out of veterinary practice. I worked through vet school. At that time, I was able to graduate after 5 years, 2 years of undergraduate and 3 years in veterinary school. Worked the whole time, graduated with almost no debt. Went to a practice where I had been working before I went to vet school. So it was just, it was like the perfect, world for me.
Yeah. And
then went on to establish my own practice in 1985. And after 10 years in practice, I, got really frustrated with conventional medicine and began to go more into the holistic route. And that has served me really well. And that is something I want to touch on, because one thing that I noticed is that as I went more holistic with my practice and minimizing vaccination, minimizing drugs, getting the horses barefoot when possible, as close to a natural diet, natural environment, took in the temperament typing, my emergency calls basically went to 0.
Wow.
So I know that was a real important question that some of the people had, because what may happen is that you may wake up one morning and walk out to the barn and have an injured horse and make your call to your favorite local veterinarian and find out their practice is closed and no one bought it.
Right.
And so then what do you do?
Right. And so, I think that one of the things this is going to force horse owners to do is to become better at dealing with their own horses' issues, which, that's not a bad thing. I mean, we can help our horses a lot, but of course there are always those times when we need the veterinarian to come out and do whatever. But I think we're going to have to become a lot more self-reliant in many ways. And so the more we can learn about good horse management, about good health practices, et cetera, that's going to serve us, but it doesn't solve this problem.
No, it doesn't solve the problem at all. It's a stopgap until we can turn the tide on things and start turning out, more equine veterinarians that are wanting to go to the rural areas.
Right.
Because
okay. So
there'll be plenty of vets in the urban areas for as far as the eye can see.
So let's start with the first question that we had from last time, which is, what can we do as horse owners to support our large animal vets? And specifically, what do the vets want from us? So
Okay.
I think this is really important, because the job of a large animal vet is a very hard job. And I think sometimes people don't appreciate just how much hard work it is and how actually dangerous it is.
Mm-hmm.
Especially when you have an animal that's wounded or injured in some way and that is in pain, that only, magnifies tenfold the problem.
Right. That is absolutely true. So I think we covered some of the things, but we can sure go back to it. So, of course, we mentioned the danger part, and that is where you as an owner can have a huge effect, because you can get your horses gentle. And now a horse that's in pain or, in a violent colic, I mean, there's still going to be danger. But if you've done your job to get your horses gentle as possible under good conditions, then when the adverse conditions are there, you have more to work with. You have a horse that's more trusting, more willing to allow a stranger to do what needs to be done to cooperate and just be a treatable horse so nobody gets hurt.
So what are some of the basics? And when you say in terms of handleability, what does a veterinarian need to do that horse owners could make sure that their horses are comfortable with, at least when all is well?
Okay. Absolutely. You need to be able to get your hands in a horse's mouth and handle all parts of their body easily, their ears, be able to put your hands around their eyes and they'll allow that to happen, be able to pick up all 4 feet and, move a horse around and, on the end of a lead rope or the end of a lunge line to be able to evaluate them. I think that, have a horse that will lower its head for examination. I mean, these are all just kind of basic horse skills that sometimes we don't think about. And just when you're going out and you're grooming your horse, just take your time and get your hands a little wet so it's not so hard on the horse, and just get your hands in their mouth and pull their tongue and open their mouth and look at their teeth and just let them know it's like, this is just something we do, like picking your feet up, and handle their ears and pick their tail up and be able to lift their tail up over their back and move it all directions so that if someone goes to put a thermometer in, they're not going to get kicked or, be scooting away or needs to do a rectal exam, that the horse is going to be okay with those things, just kind of have it in the back of your mind. What does this horse need to be used to and comfortable
I think
with?
That's where Linda Tellington-Jones and her T-Touch work has excelled so greatly, because it's so really great at helping horses who are not comfortable with those ideas to become very comfortable in a non-invasive, non-threatening way. In other words, you're not forcing the horse into it, but you're getting the horse educated so that these are normal things for the horse and not surprises, and actually feel good.
Yeah. And it's true. And the thing is that when you do it at home, you can take your time and do kind of the advanced retreat approach, where you go and you feel the horse is getting uncomfortable and just back away. And in that way, you're honoring the horse and you're not waiting until it has to be done in that moment. Right. So you get to get them accustomed to all kinds of different things being done with them. And maybe you won't be necessarily giving them injections, but you can kind of mimic that with pinching their skin and maybe even you involve treats, with it. If you have a horse that's maybe a little needle shy, that you start, rubbing that area and kind of pinching that area on their neck between your fingers where they would get an IV or an intramuscular injection, and you feed them some treats at that time to just sort of get them with a new association for that. And those kinds of things that's probably some of the most danger that I was ever in, was trying to give a vaccination to a horse that didn't want to be vaccinated.
Wow. Yeah. Something as simple and routine as that. And you wouldn't think it would be so traumatic, but it can be for a lot of horses.
Oh yeah, absolutely. And they have no problems with body slamming you and, other, various things. So those are just the kind of things that, it may not seem important because you're like, well, I don't really, plan on doing any injections with them, but you just don't know when it may have to happen for whatever reason.
So let's talk a moment about the care and feeding of the veterinarian. What can horse owners do to make sure that the veterinarian's job, is as easy as possible? Like if I was like, there was only one vet and I wanted to make sure that vet wanted to come to my place to look at my horses, what are some of the tips and tricks you can give us that that make you more willing to go out?
Yeah. Well, I mean, there's the usual things is that, like, say, you need to be able to pay for the services and you want to pay at the time of the visit and not, like, say, veterinarians are not accountants. And so that is really important. But I would say probably the biggest thing that I needed from my clients is I wanted them to educate themselves. and not depend on me. Yes, it could bring me in on discussions, but I wanted to know that when my client called, that they were able to describe to me, what was going on with the horse, that they would have been able to do a physical exam on the horse so that I wasn't making an emergency trip only to find out that it wasn't really, didn't really need, it wasn't really an emergency, exactly. And one thing that I don't think I mentioned on our Friday call that I think is really good is that when I found out about this service, this subject and the challenges, I started looking around, well, what is available to people that don't have a veterinarian? And one of the things that I found is there's an app that was actually done by Doug Thal. He's a veterinarian here in New Mexico, and it's called the Stall Side Vet. And it's really a fabulous little app. It's not expensive, and you can tell that he's really put a lot of work into it. And so you can get that app, and one of the things that it has on there, and it has videos that describe it, it shows how to do what he calls a whole horse exam.
Okay, I just tried to look it up on my iPhone and it didn't come up. So maybe I need to go to their website to look that up. But that's a great idea because,
and this is where to go. Yeah, you shouldn't have to go. Let me just see here. Make sure I said it right because I got it downloaded. Horse Side Vet. I said stall side. It's horse side.
Oh, Horse Side Vet. Okay.
Yep, that's it. I'm glad you checked.
Yep. So Horse Side Vet.
Yep. And he just really has done a great job. And I've gone through quite a bit of it. And of course, it's from a conventional medical model. But I have to say that he's really very conservative. And on his drugs, he gives advantages and disadvantages and side effects. And I haven't found anything on it that I didn't agree with, 100%. And the only thing that, that I can add to that is that, there's times when you can do things, holistic approaches that are not going to interfere with any kind of treatments that would come from your regular vet, but maybe they mean you don't have to call the regular vet.
Yep. I'm just going to hold this up so that it's out of focus, but it is available on the iPhone. It is the Horse Side Vet Guide and it's $4.99. So, that I think that's a great resource. And, the phones that we have nowadays, I'm just going to type this in, Side Vet Guide on iPhone. Mm-hmm. And it's probably available on Android too, I'm sure. But I have an iPhone. Our phones actually are super handy because we can now take pictures and videos of horses and send them to the vet. And so they know what they're walking into and they know if they have what they need walking into whatever it is. I think so often, it's someone says my horse has a colic. And since that can, if you can send a little video, they can see how severe it is. Not that you should delay on a colic, but sometimes it's something that, is like, I got to get there now, or, I can not break all the rules and drive there a little more.
Absolutely. And so this having that, having educated yourself that you can tell your vet over the phone, this is what his pulse is. This is what the respiration. I'm hearing sounds on the left side of the abdomen, but not on the right side. His capillary refill time is 1.5 seconds and his gums look pink. And, and it's so much easier, for the vet to determine, do I need to drop everything and go, or are we, we're good here. And, right. and that's where, from a holistic point of view, you can, I always say, if you have something, like a colic, you can call the vet and say, this is going on, I'm going to give him some Nux and check back with you in an hour. And, so your vet at least has kind of got in their mind, it's like, I might have a colic to go see, but you're doing things that, to do because you've educated yourself, you've got things on hand, you've got an emergency, first aid kit that has, homeopathic remedies, you've got some herbs on hand, you've got some probiotics on hand, you've got bandage materials on hand to stop a badly, bleeding wound, and you can do your end, and then the vet can be there when they can be there.
Right. Because as this crisis continues, the location of veterinarians is going to be, especially as you say in the rural areas, it's going to be further and further from the horse.
Right.
And so the further it is away, A, the vet may not be able to get there at all. B, by the time they get there, if it's a colic, it may be too late.
Yeah.
And C, it's that being able to properly assess so that the vet knows what they're walking into. And I think that's so important. I think I mentioned last time that on Martha's Vineyard, they no longer have a large animal vet. Mm-hmm. So they have actually formed a group to work with animal control in case there is a horse that needs to be put down. Rather than having the horse writhe in pain for hours and hours waiting for a vet to get there, they've come up with a system where animal control can help euthanize a horse.
Well, that's sad, but that's a great idea. I hadn't thought about that, but good for them.
Yes. And so this is where people in rural areas really need to talk to their animal control and their sheriffs and that sort of thing. And I'll see if I can't get Laura to come in and talk about what they're doing on Martha's Vineyard, because again, we're looking at stopgap measures. We're looking at things that people can do right now because the crisis is upon us, and not get caught out in the situation and then find that you have no resources and no recourse.
Well, exactly. And then if you do need to haul the horse, maybe you have to haul the horse 2 or 3 hours, you have skills to get that horse stabilized.
Right.
And and that's the other thing too, is like, you may not own a truck and trailer, but at least have access to a truck and trailer. And that's the other thing to add, make sure your horse will load under all conditions into any kind of trailer. And so that's the thing that you hope that you'll never need, but you have that skill available to you.
Right. And sometimes people don't have access to a wide variety of trailers to teach their horse to load in a wide variety of trailers. But that's where, forming groups, friends who have different trailers and having trailer loading party day.
Yeah, that's a great idea. Exactly. And so that it's, it's done when it's a fun thing, not when, the more things you do with your horse when there's no energy around it, the easier it is to do when there's a crisis.
Right. So pay the vet, and that's really important. And I think a lot of people might feel a little stretched at the moment, but the problem is the vet's already outlaid an awful lot to get there. And so knowing that they don't have to worry to try and collect the bill is super important.
Exactly.
And you want your vet to be accessible and willing to return.
Right. Yeah, that is absolutely, that was one thing that I did in my practice pretty quickly, is I went to cash only, and it simplified my life, so much, and my help that I had. I mean, I wanted them to be able to help me with the animals, not have accounting, skills.
Right.
So, I mean, I was lucky that I could manage to get back to the clinic with the checks and then get them into the bank. So,
well, and now with PayPal and Venmo and Zelle and all that sort of stuff, it's a little bit easier.
Yeah, it is definitely.
So that, but don't wait for them to have to harangue you for the bill, pay them. Or now, have you heard of, or do you know of some practices that are doing more of an annual type system where you pay for equine wellness on an annual basis, and then if there's, I think that that covers your general care, so that the vet coming out sees your horse. Because one of the things is that your vet does not see your horse until there's a crisis, and therefore doesn't know your horse, and your horse doesn't know your vet.
Yeah, no, that's a very good point. And I have heard of that, and it's kind of a double-edged sword. because I totally get that you want your vet to have a record, and your vet wants to know, everything that's been done with your horse. But what I'm hearing is some of those plans are like a guarantee that you're going to spend $1,000 or $1,500, on a preventive program that you may not, that may not be what you want, for your horse. So I think that you might almost do better to say, is there just a retainer fee to keep me as a client, and not necessarily be, it's like some of those colic programs. Like if you feed this supplement, you can be on this colic program, but then when you read in the fine line, it's also, and you must vaccinate your horse for all these things and deworm 6 times a year and do all these other things to actually be paid on the program that you may not agree to do. So, so I think that, but maybe there is something that there is like an annual fee for just a retainer fee to have a client. I think I hadn't thought about that, but I think that's a great idea.
And that's the thing, because as we talked in the other webinar, the cost of getting through vet school is so high. And so when the owner only calls you because they have an emergency, I think that vet is going to look at, is this a regular client of mine? In fact, a lot of them, if it's not their regular client, they won't come. Period.
Yeah. I mean, that's one of the things I did as soon as I could, when I got here, was called the local vet and took my horses in for a Coggins test and, and just established myself as a client. I hope I will never have to use their services, but I want, and I hauled them, was happy to haul them in and, made the appointment, well ahead of time. But I want them to have a record, of my horses and have seen them.
Right.
Because otherwise it would be tough if you just wait for an emergency.
So it sounds like developing a rapport with your veterinarian is really important.
Yeah, I think so. Yeah, I do.
And because so many of them have different types of programs, like some have the wellness program, others don't.
Mm-hmm.
But in some way, getting to know them so that they at least know your horse, or even just having them come out for a general exam or, annual films on their feet or something where they have seen this horse before there's a crisis.
Right. Exactly. And yeah, I would have loved for them to come out so they know where I live, but that just wasn't an option. They're just too busy. I was happy. Just the first time I called, it was the appointment was for Coggins was 6 weeks out.
Wow.
And so I was just like, if you're that busy, it's all right. Never mind. And, and then when I called later, it was like a week out, and it's like, okay, that's they must have been able to get things under control a little bit better.
Right. And there are also busy times of years. If somebody's doing a lot of repro, springtime is a busy time.
Mm-hmm. Yeah.
So knowing what the sort of state of the equine industry is in your area in terms of the, whether it's breeding operations or show operations or trail riding or whatever, so that you kind of know, you don't want to do your routine during their most busy season. They're not going to, they may not be able to come, or they wouldn't appreciate you anyway at that point.
Yeah. Yeah. But I like that idea. And if you don't agree with or want to do the full preventive program, I would be willing to say, I will pay a fee to have a, guaranteed service if I need you.
Right. Which I don't know that I've heard of anybody doing a retainer fee just yet, but I certainly think that is something that would be a good idea to consider,
right.
Because it gets you on their list. It gets you in their client list.
There's some human medicine that are using the concierge service approach, and where you pay a fee, an annual fee, and then you have access to the doctor directly. So it's like I can actually call you on the phone. And so right now that's probably not feasible because we don't have enough veterinarians. But if we start to change our models,
right,
and start, and say, yes, we want to graduate more equine veterinarians, but with less of a pressure. If we have more veterinarians, then they're able to practice the way they want to practice and not necessarily, be just swamped and, 7 days a week, 365 days a year, holidays. And, maybe that's a choice that some veterinarians make. So maybe I'm not going to have a huge case, a huge number of clients, but the clients that I have pay me whether I come to see their horse or not. In other words, I'm kind of like paid to keep the horse healthy rather than, if you're paying a certain fee to have that veterinarian, then it behooves the veterinarian to keep your horse healthy, because then they're still getting the same fee and not having to go, for emergencies and that kind of thing. So maybe that's a model that we throw into the mix.
It's not a Chinese model that you pay the doctor as long as everything's healthy and you stop paying him money.
Yeah. It's like that. What a novel concept.
Yeah.
Absolutely.
And of course, I jokingly talk at care and feeding, but when veterinarians arrive, if they're in need of facilities or they're stressed, like just being ready with your horse, having the halter on, having the horse brought in, not having to go out in the field to get him, having somebody there to help with the horse. There's so many things about this that we don't consider. So what kinds of things, if you're arriving on the scene on a routine, what kind of things would you like so that you can be efficient with your time?
Yeah. Well, like I say, that's perfect. Having the horse caught, being able to be given a assessment of the vital signs, on the horse, and having having hopefully a place to work that is covered, and if it's bad weather, inclement weather, that is blocked from the wind and the rain, having the dogs put away. It's just basic courtesies. And
but having the dogs put away, a lot of people wouldn't think about that, but that's, if you've got the dogs running around while you're trying to examine a horse, it's really much more difficult.
Yeah. Yeah, no, it is. And once you've kind of done your assessment and everything, if everything's gone well, the dogs can come back out again. But yeah, there's nothing like, picking a foot up on a horse that's already not feeling well and the dog darts between the legs. And it's just, those just are the kind of things that, people don't think about because, they're like good dogs.
Right. Turning your cell phone off, or at least on silent.
Yeah, right. Yeah. There's just, those are, but mainly a safe, protected area to work in. That's really huge.
Okay.
Yeah.
So not out in a windstorm, in a muddy paddock with 32 degrees.
Yeah. Where you've got to wade through. Yeah, it is. It's. I mean, I've been there. I've done all that. Sometimes it's unavoidable. I mean, the horse is back there and it's injured. You got to get back there. That's no problem.
Right.
But they're just kind of take into consideration. And just this time wise, if it's an emergency and your vet's been called away and they've got other people waiting, the more information, like I say, the more information you can share, the more things that you've already done to start to stabilize things. If it's a wound, you've cleaned it up somewhat, and there's just those seem like really little things, but to a vet they can be everything.
Right. And one of the things I just thought of is easy access to the horse with your truck.
Mm-hmm. Yeah.
If you're having to haul stuff from your truck through the muddy paddock again, out to where and it's not always possible, but just thinking about, if you have to get your x-ray equipment out or something else out of your truck and you've got to get it to where the horse is and it's not easy, then it just makes your job that much harder.
Yeah. Yeah. And the farriers will say the same thing, and oftentimes if it's possible, it's nice to have that, sort of treatment exam area sort of away from the main barn so that you can have some privacy and fewer distractions. Maybe it's kind of, back off the side of the hay barn or something that, that you can drive around back and, have access, but then there's not all the, just a little quieter environment if possible. That's right. Fabulous.
And it's not about fancy, it's about functional.
Oh yeah. Yeah. Yep,
right?
Absolutely.
A dry pad to have the horse stand on, a cover over your head to keep the rain off, a wind shelter, a wind break of some type, and easy access with your truck.
Mm-hmm. Yep. Yeah.
Okay. So we have other questions here. Why don't you go ahead and pick another question that we had from last time and let's talk about it.
Okay, the second question that I thought was really good, and it's like, why not get a local vet to extend his practice by specialists instead of having the specialist spend $250,000 to work on your horse? If I understood that question correctly, it would basically be that maybe we have a local vet that doesn't have the same level of expertise as the specialist and is able to do the routine, work on your horses. And then if you need the specialist, you refer to the specialist. Is that the way you took that question?
I'm not sure. I think you could read it in a couple different ways, but let's at least hit that one first.
Okay. Yeah. So that's kind of my point with what I was talking about. The program for graduating is specifically an equine veterinarian, and being able to shorten the time in school and definitely shorten the expense of school, and graduate with a complete degree to be able to do all procedures on a horse. But you're not necessarily going to graduate with that program and immediately start doing colic surgeries. You are going to have your ambulatory or your practice where you can do the routine colics and you can do your lameness exams, and maybe you've got a good quality x-ray machine and you can handle all that. But if you have a horse that needs a colic surgery, or they need orthopedic surgery, or you need a MRI done on that horse, that you have a relationship with a referral clinic, and that referral clinic handles those kinds of situations, those kind of skill sets. But to take that kind of a step further, and I'm not sure how you would do this, but what I would like to see is those referral clinics focus on referrals. That's kind of what you have more of the small animal model. They're not taking that person on as a client. And because you referred to that hospital, the client's like, well, why don't I just want to use them as a vet? And that way I can get everything done all at one place. That's not really fair to either, that veterinarian that went and got additional schooling to specialize in, surgery or whatever it may be. They're not necessarily going to want to be, suturing your horse that cut his shoulder. So
right, they want to focus on what they do best.
I'd like to see kind of a mutual agreement that if I refer a horse to you, that horse comes back to me, and you handle what I sent the horse for, the same thing. And I would think that you could probably have a referral clinic and an emergency clinic be under the same roof, and have like a 24-hour emergency service or handling horses that need intensive care. But then when that horse is ready to be discharged, he's discharged back into the referring veterinarian's practice. And one of the things that we talked about is like, well, do we, you want to have a relationship with a veterinarian? I would like to see it that if you go to a referral hospital, you have to be referred by your attending veterinarian. You can't just call the referral
that
hospital.
Works in the small animal world. My cat Buster went to the vet for what I thought was going to be getting his teeth cleaned, and it turns out he has a heart problem. So they referred me to the cardiologist,
right.
And he goes every 6 months to the cardiologist to get another echo, but he comes back to his local veterinarian for his routine work.
Yeah, and I think that's some of the models that we can follow in small animals. Same with emergency clinic. If at 5 o'clock in the afternoon, after 5 o'clock in the afternoon, you don't call your regular veterinarian, you call the emergency clinic. And then you take the dog to the emergency clinic, and then when you are, at the 8 o'clock the next morning, when your regular veterinarian opens up, you take the small animal to your regular veterinarian. And I think we could make something like that. I think that's a very good model. And it's like everything's going to involve cooperation,
right?
But yeah, have the referral hospitals for after hours and intensive care and specialty procedures. And then, and then you have your regular veterinarian that is handling all your other needs, that knows your horses, that's been to your place, that knows your management, knows the horse's other, ongoing chronic conditions or whatever they may be. And that's who is then, kind of working with the referral hospital and giving them the information that they need. And so it's a very cooperative exchange of the correct information. And especially if you are, if you're the owner of the horse and your horse is, having some severe problem, I mean, you may not be remember the horse's history. Right. And your veterinarian, when he's doing the referral, oh yeah, by the way, this horse has had a couple of colics and here's what we did for it. And here's how he responded. And,
right. No, that's really important.
Yeah.
Well, and the other piece of that is your veterinarian would actually get some sleep.
Well, it's really, I mean, I did all my emergencies for many, many years. And, there's times when you want to make that call. But right. At the same time, there's other times when you're just like, I'm just sitting down to Christmas dinner, taken to the emergency clinic. Right. And, and having that option to be able to do that. Or what I learned with my clients when we started doing, this holistic approach and they started keeping homeopathic remedies, if they called me and said, I've got this horse that's been colicking and I've already given him 3 doses of Nux and 2 doses of chamomile and 4 doses of Fast Track, he's not any better, I'll just say, I'll meet you at the emergency clinic. I'll meet you at the referral hospital. Because that right. horse was pretty much guaranteed going to be at surgery. So, so that's why I say I had so much fewer emergencies. And then when I did have, that situation, I packed my bags, I knew we were probably making a trip to the referral hospital. And
for all of you listeners, we've talked to Dr. Joyce Harmon numerous times about holistic healthcare. So there is plenty of webinars with Wendy that can give you more information about things like homeopathy and that sort of thing. And I'm certainly willing to do more of those, bring Dr. Ward back, bring Dr. Harmon back. Yeah. And talk a bit more about that in other webinars, because I do think you're right that having these complementary medicines and ways of treatment can really minimize or alleviate a lot of stuff or simplify it, I guess is another way to say it. I've treated my horses holistically because they've lived at Joyce's barn since 1999. Mm-hmm. Yep. And when there has been an emergency, it's been I've had 2 horses where it was something Joyce was not going to solve, and actually we lost both horses. But there's so many times when just doing simple things like homeopathy has really turned the situation around. Yeah.
Absolutely. It's not just colics, just that horse that's kind of off its food and you're not really sure why, and you don't necessarily have a diagnosis, but there's some things that you can do that kind of help support the immune system and keep the horse comfortable. And 9 times out of 10, they just work right through it on their own. Yeah. And they don't necessarily, not only do they not need to be seen by a veterinarian, but once you call the veterinarian out, they're going to feel like they need to give them something. Yeah. And, they might not even want to give them something, but they're going to feel like they need to justify having, come to see the horse. And so many times it's for ourselves as well. Letting our own systems handle things is the best way to go. That makes your system stronger. And so it works better the next time.
Yeah. And again, that having that good rapport with the veterinarian so that you can contact them and say, I have this and this going on, mm-hmm. I many, many times Joyce has gotten a text, I have this and this and this going on. And she just pops back with something, and I know how to handle it because I'm so familiar. I have to say, when I first moved to Virginia and had a horse at Joyce's, I had discovered complementary medicine while I didn't own a horse, and I found myself floundering at first because I didn't know how to use that kind of thing like homeopathy and stuff on a horse. I knew it for myself, and and I had stopped But it was this huge, like, brain freeze, kind of like, OMG, how do I do this? Right. So,
well, I think that's such an interesting point, because part of the biggest thing, and I think Joyce is the same, is that you have to change your whole way of thinking. You've got to shift out of this, oh, this is a symptom that I have to remove.
Yeah.
And you have to start asking yourself, oh, I have this symptom. What has caused this? And then you go to the cause, is where you want to, to put your focus. So it's one of the things that I talk about with the educating of my clients, and why I've continued to travel back to Texas to see my clients for all these years, is because they think like I do. They think holistically. And so I have a lot less of that. He has a fever. What homeopathic remedy can I give him?
Yeah.
It's like, where do you think that fever came from? Tell me more. So, and it is that, that it's just so ingrained into us that they need a drug. And I know when I was first making the transition to the holistic thinking, and had my clients who were working with, and I have to say, unfortunately, a lot of the chronic disease I helped contribute to, thinking that I was doing the right thing. But I graduated from vet school thinking that I knew everything, and that if there was a vaccine that was made, it didn't matter if the disease happened in Africa. You never know. We should vaccinate for it, because we know that there's no harm in vaccines. I mean, that's really what I truly believed. And that if they had a fever, my God, they had to be uncomfortable. Let's give them some bute. Or if they took a lame step, well, we don't know what it is, but let's just give them some bute and ride them and see if it gets better. I mean, that just was the thinking back then. Yeah. So when we started going to the holistic approach, because what was happening is the horses in my practice were just getting sicker and sicker. They weren't getting healthier. And, the chronic colics that started out colicking twice a year were now colicking twice a month. Oh. And the laminitis horses that, had about, maybe just, every third year, if the spring was particularly lush, now chronically lame all the time. And because I'd been in the same practice for 10 years, I'm seeing this and I'm thinking, this is not the direction that I want to be going. So when I started bringing in the holistic, and people would call me and they would have an issue, I said, well, let's use, this homeopathic remedy. And they're like, I don't know about that. But they hung in there with me. And sometimes there were kind of some contentious moments there when I would remind them, it's like, so should we just keep doing what hasn't been working? Yeah. And, you'd have to have some of those hard conversations. But I do really, I have no doubt that 10 years in a strictly conventional practice, and then probably 10 years where I did some of both, and then 20 years where I've done almost exclusively holistic, the horses on a holistic program are unbelievably more healthy. Yeah. Have so many fewer problems. So maybe that is, I never want anybody to be without access to a trained equine veterinarian. But if that is going to happen, then I would say have your horse on a holistic program so that you're at least less needy, of a veterinarian. Yeah, you're not dancing around all the symptoms. You're actually getting to the root and creating a healthier animal through a holistic process. And it is a process, because like I said, I can remember when I first started, I was at such a loss. And then, Joyce was there to help me. And of course there's books, and now there's so much more information. I mean, that was 99. And now, just even the webinars that I've produced tell people a lot about the alternatives that exist, or the complementary medicine that exists that they can do. And I think people are becoming much more aware of things like nutrition and sugars and that sort of thing. So overall, I think it's a little bit easier just because there's so much more information available. But that so much more information isn't always easier, and that's part of educating yourself, is because there's so much to sort through. And what I would advise to people is look at, find a veterinarian with a system that you agree with, and stay with that teaching. and don't be going unless they're, looking up something on the internet and are going to a supplement, company and getting this information. It's like, I'm going to do this. And even though your vet, is maybe not in agreement, with that, find a vet that you believe in their system and stay, do everything they say, because, it's there, if you trust them or not, if you don't trust them, keep looking until you find that person information that is consistently given you the information that you found valuable repeatedly,
and that fits with your belief systems, right? I mean,
right? Exactly. Yeah.
All right, so let's go back to our questions here. I always think about farriers. This is another question. I always think about farriers. Why does the industry see that profession as different in terms of qualification to practice?
Yeah, well, my suggestion on that is don't mention that to anyone. I'm not kidding, because there have been undercurrents of we should bring the farriers under a regulatory body, and it's like don't even think about it. And so far the farriers have not been regulated and licensed, and I'm just saying we don't want that. So it's just, farrier is a skill, just like equine medicine. I'm not saying it's any less of a skill, but I would rather see less regulation than more. So
and education, and I think that's we're seeing more and more education available for farriers. Is it?
And there are actually quite a increasing number of farriers who are also veterinarians.
Yes, and I actually know a couple, and I think that is really awesome, because they can then bring. How do I put this? I think that having been a farrier first in many instances brings in a kind of groundedness into their veterinary practice.
Oh, absolutely, because like I say, no foot, no horse.
Right.
So I think, and that's where there again, I keep coming back to having a 3-year program, a 2-year of classroom and clinics, and a 1-year paid internship. There could be, in addition to the body workers, that we talked about, that them, saying, yes, I'm going to go through and get my veterinary degree, my equine vet degree. I imagine that there'll be some farriers that will do the same. That, it's like, I want to be able to do hoof surgery, and and I want to be able to do venograms and specialize in laminitis, or or specialize in surgery of the foot. And so I think that by taking the other species out of the program, you're not turning out an any less educated equine veterinarian. You're just concentrating that time and schooling on the subject of horses.
And in many ways, even creating a specialist, because if you've got somebody who's an equine dentist and then they become a DVM, right, they've already got their specialty. They know it well. Yep. Now they have, they can give the drugs themselves to the horse to sedate him, to do the teeth, rather than like getting the veterinarian there and making sure you've got all the appointments, and, it just simplifies things.
I think that it'll be a changing paradigm.
Right.
And that will be a little, challenging to do, but like I'm saying, don't change. I'm not saying we change the current program that we have. You still have that veterinarian that wants to go to 8 years of school and have all their options available to treat any species, go into research, do whatever they want to do. But for that veterinarian, like I say, that farrier that's like, I could just do so much more for horses if I had my DVM degree.
Right. Right. And your idea, like, that they could go back if they specialized in horses and then they decided they wanted to do small animals, they could go back for that additional education to then become small animal vets.
Right.
Because, I'm trying to think if anybody's done a study to see how many vets start out, say, in large animals and wind up in small animals. And because that's where you'd see, well, if 90% start out as large animal, but wind up practicing small animal, then maybe
it's 60%.
It's 60%.
Yeah, that's what the veterinarian, Dr. Steele, that was the stat that she said, that of the 42 veterinarians that are graduated per year that go into equine practice within 3 years, 60% have transferred to small animal.
Wow.
And I think that's going to, all the things we talked about. But, there it comes. It's like these programs that are focused on equine. And when people go into them, their intention is to do equine. The admittance would be counted not on your GPA, but on your experience with horses.
Right.
And so I think part of those reasons we're losing some of those vets, in addition to just the daunting amount of debt that you have that may not be able to be supported to be paid back in an equine practice, is also, it was like, well, it looked romantic at the time, when, I always thought that, just that, horses were just so beautiful,
Yeah.
But if you've grown up with horses, you're going to know that they're dangerous, and you're going to know that they get sick on holidays and in the middle of the night and during ice storms. And, so it's going to be something that you already know that, and you want to do it still.
Right. I assume then they're doing a lot of surveys to try and figure out kind of where people are going, or how they're filtering out, or why they're filtering out, so that they have more data to be able to make good decisions.
Yes, they definitely are, and that's where I think they've come up with some of these reasons for not staying in veterinary practice, and the debt, the long hours, the not ever having any kind of balance, any kind of family life. And
right.
those things can definitely be changed very quickly if we increase the number of equine
right.
veterinarians, and we change our model up. Like
right.
I say, we have a model more like small animal, where people, where you as a veterinarian have the option, if you want to go and see that emergency. Maybe it's a horse that you've been working with and you're very involved in the case, and you don't want to send it off and get somebody else involved at this stage of the game.
Right.
But at the same time, when it's your daughter's, first volleyball game, and, you're like, yep, no, I need to balance. This is family.
Right. Or, women veterinarians that get pregnant. It's, you don't want to be handling a 1,500-pound beast.
Right. Right. Yeah, no, I mean, it's just, having more veterinarians and having more options, having fewer hours, having more control over your personal life. And also, I think having the option, I mean, we have so many amazing diagnostics.
Yeah.
And so if someone an hour down the road has a digital x-ray machine, maybe that's an expense that you don't need to have for your practice. Maybe
we haven't even touched on that, the cost of equipment outside of the cost of education. I mean, I've been to AAP numerous times, and you walk around the floor and you look at the price tag on some of the equipment that's there, and then people want the latest diagnostics, but do they really understand what kind of debt that veterinarians are getting into to have that available, to have it on their truck, and not be using it to its fullest extent to pay itself back?
Exactly. And that's where, that's where you can say to the client, it's like, no, I don't do radiographs because such and such practice down the road has state-of-the-art equipment, and I don't think your horse should have any less than that.
Right.
And so that was really one of the things that I hated to do more than anything else. I went out and radiographed so many horses out in the field with an extension cord, got all the way back to the clinic with my, little solutions that I had in the back, only to find that the angle wasn't right. And, and it was a half a day, and it's like, I can't use these films. And, and so that was just one of my biggest aggravations. And I look now at the quality of radiographs that I see, and I think, I might still be at a conventional practice, if I had this.
So, I mean, just roughly, what is the cost of a mid-range price digital x-ray machine?
Oh, I have no idea, but I'm sure it's probably, $50,000, I'm guessing.
Yeah. I think that's about right.
Yeah,
Yeah.
yeah. So they're just, there's so, if we go into this with an and both, attitude. And what I am a little bit concerned that is happening is that because we have veterinarians who are the ones that are studying this, and they're looking at it from the veterinarian's point of view of, what would I like to have, that the model that they're going to come out with is going to serve veterinarians very well, and maybe less the horse owner and the horse. So I think the more we can get, as horse owners, we can get involved and say, this is what we really need from our education system. This is what we need from you.
Okay, so this is a great lead in then to my probably last question, maybe not. What can horse owners do to voice their concerns and bring up these kinds of issues to the equine veterinarian profession? I mean, what do we do?
Well, I think first thing you do is you start talking with your own veterinarian, get their story, hear their point of view on things. And, there's not going to be probably any one person. Like I say, I know the AAEP is really working on this, but AAEP is made up of veterinarians.
Right.
So the more equine veterinarians are getting feedback from their clients, then the more they can, like I say, I guess there's going to be more focus on this at San Diego this year. There certainly was a huge amount of focus at San Antonio last year. So, more veterinarians are aware, and they can say, well, here's what my clients are suggesting they would be good with. They would be willing to haul to a referral hospital as long as they had someone that could come out to their place to evaluate a new foal. It's just.
Okay, so the first thing is then that we can talk to our veterinarians, our existing veterinarians, the ones we're using, and tell them, have this conversation, of, what happens if you retire?
Right.
What, have you thought about this, and what can I do about it? Or this is what I am willing to do, right? Mm-hmm. So have the conversations with your veterinarian. But how do we ensure that that's going to get up to the powers that be?
Well, then people know the powers that be, because I don't know who the powers that be are right now.
Okay.
But I think that you're going to have to be going to the veterinary schools and saying, do you want to be the first one to do this pilot program? And I would say you start. I'm going to turn on my light real quick here. You want to start with maybe some of the schools that are in more rural areas. And say, would you like to be what would it take to do a pilot program for like this LMU program? They had to come from somewhere that they put this together, and I think it's a great program. But I think we could have that, and we could have
we need to multiply that a lot.
Yeah, and we need to have other options. It's like, well, I'd really like to have a mixed animal practice, so this LMU program looks like that's perfect for me. And then the other person's like, I just want to do horses. I don't want to do pigs, cows, goats, dogs and cats. I just want to do horses. And then you go to the 3-year, straight equine DVM route. And we just have different levels, different options. And then like you say, if you change your mind, you say, we lost our small animal vet in my small town, so I need to go back to school and do that. I need to add that, to my practice.
Right. So the second thing we can do is, if you have any contact or are near an equine, a veterinary college, veterinary university,
college, a state board. I think the first thing is just start finding out what is really wanted. Do we want more the model of the LMU, where it's more that it's a 6.5-year program, but you can do all species, or would people really prefer? I mean, I know for myself, when I would go to people's farms and they would, want me to look at their goat, I would be like, I don't do goats. It's like, well, you went to vet school, you should know how to do goats. And it's like, I think I might have had 2 hours on that.
Exactly. Yeah. I think people don't realize how little time is on some of these, it's like I mean, okay, so I used to work at Dartmouth Med. I'm dating myself a long time ago. And
You
I
and me
was a
both.
research assistant, and I would watch these MDs come out of Dartmouth Medical School, and you just realize how little they actually knew.
Yeah,
right?
that's why I want the internship, and that's what LMU is doing, which I think is critical. A paid internship so that you get supervised in your training. You're not
and
having
mentored, supervised and
mentored.
mentored.
Exactly.
I think
I mean, I
mentoring is
had
huge.
that with the vet, that I worked for the first 5 years. I think probably maybe for the first year, I was not allowed to go on any calls by myself, and I didn't want to.
Right.
And, and I remember the first call that I was sent on, by myself. And it was to a client that we knew really, really well. And they were so, supportive. And it was a horse with a colic. I was so nervous, passed the stomach tube and checked for gas and reflux and all those things. And then pulled the stomach tube. And I'm like, the horse is, and she just smiled and started to walk off. And I was like, oh my God, I didn't give it any oil.
Yeah.
And I was horrified, and I was like, what am I going to do? And I called and said, and she just turned around, brought the horse back, didn't say anything, so it's like, we need that,
I think what you're describing is
mentoring, and you need to be introduced to your clients, not when you're expected to come up with the answer for this something really serious where the experienced vet's there to hold your hand.
Right. And veterinarians are human.
Yes,
I think that's the other thing, is that we're all human, right?
Right. Yeah. It's just, I mean, I wouldn't trade my, my career for anything. And I look at the vets that are graduating now, and I see such a different, I think about it. If my only option was to be in a clinic where there were multiple veterinarians and everybody, just whoever was available saw the horses, and you didn't get to know your clients. My clients are my best friends now.
Yeah.
And we've known each other for 40 plus years. And I'd go to their farm and they'd be like, be there in a minute, help yourself to coffee, and it's just there's just something special about that. And
it's a trusted rapport with your clients because you've been there for them for so long.
Yes, absolutely. And so, as much as I want to see the best diagnostics available, for the horses, and I want to see quality of life, for our veterinarians, but I would just hate to see us lose that going to the farm, to see the horses, like say, the new foal that's, that you get to see, that you've gotten this mare through a pregnancy and got her pregnant to, and now you get to see and this is the horse the dream horse these people have been waiting for, and it's so special to them. And, it's just, I don't want to see us lose that. I think we have that, and we have the referral hospital where you can get that expensive barrel horse or jumper, a nuclear scintigraphy, and find out why they're lame. You've got to have, I think we can have all of the above.
Right. So, do mention the what you sent to me in the email, because I'll send it out to everyone.
Yeah. So as far as my ideas on the vet school.
Yes.
Okay. So here's what I have put together. Where did it go?
And I'll send it out. So I think if you just read kind of that bit that you were talking about.
So here's my goal for the program. So my proposal to the vet schools is to keep their current curriculum and requirement for students who desire to treat all species, research path, whatever, but also offer a separate program to graduate equine-only veterinarians. But it would only allow for the practice on horses. And and my feeling would be that that's a straight out of school, assuming you've taken advanced science, in your high school. If you had, there would be an entrance exam to prove proficiency, in your sciences and your math, and which I had to take to go to, I don't know if it was to apply to vet school or even just apply to Texas A&M. I remember SAT, your basic SAT, which my counselor was like, wow, you're really good in biology and you're really bad in math. And I'm like, does that matter? And he's like, well, we'll work with it. So assuming that you can pass that entrance exam, you don't have to have the 2 to 4 years of pre-vet. I'm just not sure that we would have to have that. And if we want to get the cost down and we want to get these vets turned out quickly and we want to bring in rural veterinarians, I think the quicker we can make it happen, the better. So that's, and then the experience with horses and desire to practice in areas in most need would have the most bearing. I mean, assuming you would have a basic GPA that you would, I think the other school was like a 3.37 or whatever, a good solid B average. Because right now, to get into vet school, you've got to be up there close to 4.0. Right. And that's, that's great. That's wonderful, but there's more skills than that are needed.
Yeah, I think you lose the people that are maybe, more out on farms working with, more working type people, which is what you need in the veterinary practice. It is a physical job.
It is. Absolutely. They know what they're getting into.
Yeah.
That is exactly right. And they're smart, but they're like ranch smart,
right.
and they know how to handle animals and they know what a sick animal looks like. And so those.
So is there anything on the current entrance exam that investigates whether or not they're have spent their life on a farm or anything like that?
No, and no, not at all. And they don't even get it. They don't even get to the interview stage.
Oh, wow.
Yeah. So the way the current system is set up. And that is, like I say, this LMU program is definitely the same thing. They're emphasizing experience and desire to go specifically into an equine, and that if you go into their program, their pre-vet courses, and you maintain that GPA, you're guaranteed a spot. Wow. So that means a lot too, because right now,
huge.
Get into the pre-vet program and do all 4 years and never get an interview.
Right.
Never get the opportunity to even apply to veterinary. You can apply, but even get that close to getting in. So I would be a 2-year equine-only classroom and clinic training and a 1-year paid internship to complete the program. And all your classes, your anatomy, your pharmacology, toxicology would all be focused on equine. So you're not necessarily learning the latest cancer drugs for small animal carcinomas.
Right.
You're learning for horses. And it's not like the curriculum isn't already there. It would just have to be pulled out of the current curriculum. Just pull your horse focus out. And so I think that would have to be like newly invented.
Right.
And the same professors that are teaching it currently in school can still be teaching it.
Right.
It just will have to be structured a little bit differently. So I think it could definitely be done. And let's see. Yeah. So, and I would do it. This is something that didn't happen for me in vet school. Maybe the vet schools are doing things differently now. I think some of them are, but we had like 2 years of classroom only. And then we went into clinics. If I had been having clinics at the same time I was having my classroom work, I think it would have made it so much more interesting.
And also applicable. I mean, you're doing your classroom work and then you're going out and looking at animals. And
Right. Yeah. Exactly. You would understand why it's so important to understand pharmacology, that medication that you just gave, that it is going to be metabolized through the kidneys, and you have a horse that's already got compromised kidneys, and how that would be, you'd have to be careful using that drug. You would be learning the reasons, at the same time. So I think some of the vet schools are, like I say, it's been a long time, since I graduated. So I'm sure some of these changes have been made. At the end of the 2 years of classroom and the clinic learning, you would be immersed in an internship, on the job training with supervision. And, maybe the schools would have to set the salaries that you would be paid and the hours that you would work to not let anybody be taken advantage of. And that would be fine. But at the end of that time, you're going to take your state boards just like you would after graduating. You still have to pass that state board.
Right.
So you're going to be studying along with, doing your internship. It's not going to be easy. It's not going to be any easier than regular vet school. It's just going to be more compressed and more species specific. So passing a board exam written specifically for equine would allow full rights to practice. Let's see. Existing university or established equine hospitals could apply to take students for internship programs. These students would provide needed trained assistance to those clinics, and the students would be receiving the training. It'd be a win-win, for everyone.
So now this is a letter that you've written that is going to whom?
I sent this to Dr. Foley, who's working with the committees at AAEP. Great. And he received it. He said, I'm, sending it up the chain.
Okay.
And so, we'll just go from there. But the main thing I want to know is this a model? I'll get through it and we'll see if we get feedback from people. Does this sound, is this someone you would want to have, working on your animals? I mean, would you support this from your equine veterinarians and ask for it? So that the interns would be paid a fair salary, perhaps set by the school, but this salary would be well below that would be paid to a veterinarian that was graduated.
Right.
And being paid for that internship there again, it's just anything where we can lower the debt burden and get veterinarians out there, and also allow the practices that are already established to hire someone that they can pay a little bit less to, but they don't have all the debt they have to pay off. So that, so they're still having, the graduating veterinarian is still having a net income. It's just not all going to pay their debt back. In other words, it's going to lower costs for everyone.
Right.
Involved. Because the model right now is saying basically no middle class horse owners. It's like,
yeah, which is insane.
Yeah,
insane
we can't have that. But
right.
That's the model that they're going by. Because it's like, well, we can never lower the cost of education. That's never going to happen. And it's like, oh yeah, it has to happen. So who is proposing this model that there will be no middle class horse owners? It's pretty well. Is it AAP? Is it the boards? Is it the vet schools? Who is it? Well, I think it's the general, the people that are looking at it. I've heard it from two different places, and maybe that's not a huge number, but the veterinarians that are in practice right now that are that are saying that's what Dr. Steele said, and that's what Dr. Amy Grice, both of them that are vocal on this subject, they're both saying the same thing. Yeah, but I mean, this is where horse owners can stand up and go, we want to have a middle class horse owners category. Right. We don't want you to eliminate us just because we can't get a vet. Right. No, I think that's exactly right. And I'm not saying that's what the veterinarians want. I'm saying that's what they're saying. But if they're already talking about it, then yes, it's already in their mindset. It's already in their mindset. It's that this is the direction it's going. I'm not saying they approve of it or are happy with it, but it's the facts. Well, and this is where, when I go to Europe, and I haven't been there since COVID, but their model is put horse riding schools in communities so that everyone has access. And, there's different levels of group classes and that sort of thing on school horses and stuff. But you develop a culture right from the beginning because it's embedded into the community, as opposed to what we tend to do in this country, which is isolate. Oh, I don't want the flies. Oh, I don't want this. Oh, I don't want the smell. And we isolate it and make it less and less available. But the value of having horses in people's lives cannot be underestimated. We've been with horses forever. Yes, and absolutely. You look at the European model, there's little kids riding. I mean, you go to Equine-Only, my last one was 2019. And on Kids Day, I mean, we were swamped. Yeah. If you want a healthy, functional kid, give them a pony. And right. Get them into riding lessons. And exactly. So, I think that we have to look at this from many aspects, but the fact that they're just already dictating that, just pronouncing, I should say, that we're not going to have a middle class. I think that's where we have to start. The writing on the wall, because they're looking at the kind of salaries that veterinarians coming out of school are having to ask for. And the clinics are saying, well, if that's what we have to pay a brand new graduate, then we're going to have to, our fees are going to have to reflect that. And that's not going to support a middle-class income to pay those fees. I mean, even some of the fees that I've seen from people now, and I think of like, oh my God, that was something that would have been $120, total call, and it's $1,200. And, so it's just, that makes it hard. It's not sustainable. It's not sustainable for the middle, and I think unfortunately.
Yeah, but ultimately it won't be sustainable for everyone, because if you eliminate the middle class, you're going to eliminate horses to a very few, and then we've
got to change things if we don't want to go that path.
Right.
Yeah. So here's my goal of the program: is graduate enough well-trained equine vets to serve horse owners in rural as well as urban areas. Graduate enough equine vets to lower the burden on the small number of current vets. Add enough equine vets to staff multiple emergency-only and referral hospitals that would not take regular clients but would provide 24-hour care for horses needing intensive care and offer more diagnostic and surgical abilities. This would free small clinics or ambulatory vets to focus on routine needs for their regular clients while still maintaining their own quality of life. Clients would need to have a regular equine vet to refer them to an emergency clinic for intensive care diagnostics. This would encourage clients to develop a relationship with an equine vet before the emergency develops. Horses that are unruly or clients who are difficult would have trouble developing a relationship with a vet, and they would be encouraged to be better stewards of their animals. They would not be able to go directly to an emergency clinic on their own. This would serve the horses as well as the vets. And this might be in there too, where you have that, concierge type service that you just have to make sure that's one of the services that's provided. Maybe I only see your horse once a year for a Coggins test, but you pay me X amount. If it does have an emergency, then I'm able to refer you. And I will do prescriptions for you online or whatever. That's part of the service.
I have one other question for you, actually. How is AI going to impact all of this?
Well, let me finish, and then we can talk about that, because I'm already looking at that. So 2 more things. So many very hardworking and caring students will be able to pursue a veterinary degree, which would not have been possible with our current system. Many of these individuals will have extensive background with horses and understand the challenges of dealing with them in a safe manner. We've talked about that. They will already have established contacts within the horse world and have jobs waiting for them upon graduation. There's currently a challenge that many lay practitioners offering service, such as chiropractic, dental, acupuncture, osteopathy. With our current system, it is difficult to add these modalities to an already overloaded curriculum. It is not ideal for lay practitioners to be providing these services, but they do work and they do good work and clients desire to have them. I believe that many of the most qualified and serious lay practitioners would apply for and go through a 3-year program to have the training to be an equine vet and offer their modalities without any friction, from boards or from colleagues. They would be on equal status. And so I think that I believe that the answer lies in lowering the cost and time involved to receive a doctorate in equine medicine. And I think this would be a success for schools providing it, the students, current vets, and the owners and the horses. So I think so. I'd be just curious to see what people think about, advantages, disadvantages, what the thought is. So then to go on to the AI, I think AI has the potential I'm looking to use it as an education tool. I've been writing books, doing speaking at meetings, writing magazine articles, doing podcasts for 30 years, ever since the internet came up and you could start doing that. The challenge is I don't even remember everything that I've written. I mean, it's just so much to try and learn. And most horse owners are not wanting to be horse experts. There's, yes, there's basic skills that you need to know and you need to teach your horse. But as far as going home and studying for 5 hours about, horse anatomy or, how the stomach works or whatever, that's not their, I get that. That's not really what they want to do. Where I'm going with AI, and I'm working with a company to help me do this, is to get all my information loaded on a hub where it can be searched with an interactive AI that's trained on my material. So it can be trusted if you like my style. That's why I say, find a vet that you like their style. Me, Joyce Harmon, Peggy Fleming, Kim Hinneman. I mean, find someone that you can agree. I mean, maybe your conventional vet, like I say, the Dr. Thal that has this stall side or horse side app. You can tell from going through that he has put a lot into this. And if you're his client, I would think you would want to have that app and you would want to know it backwards and forwards. So that's where I think AI could be used constructively, is in the education process, so that as you go out to the barn and your horse isn't eating and you're thinking, oh, I might have a colic. I wonder what kind of colic this is. And you can go and instead of trying to go to my website and find articles on colic, you can go to the AI program and say, what are the symptoms of an impaction colic? And you can get that pulled out of the information available to you. It's like, what can I give for an impaction colic that's safe? And, of course, you've called your veterinarian and you've said, I may have a colic, but you've got things that you can do in that moment that are safe, that are proven, that aren't going to hurt your horse, can only help your horse. And you can learn it right then in that moment when you need that information. That's what I'm hoping to, and it, like I say, it's information that you didn't just search on the internet, that you have no idea.
Came from a trusted source.
Yeah, it came from a trusted source, exactly.
And that's the biggest problem with the internet and with AI, is whether or not it comes from a trusted source,
right.
A real human being in the end.
And the thing is, something that you get on the internet might be true in a different situation. Right. It's not that it's wrong information. It's just not, the information that I teach, I try to teach you why I'm saying that in this situation. Why you would give Nux for an impaction colic, because it helps to gently stimulate motility. Why you would give probiotics in impaction colic, because the healthy bacteria stimulate motility, so that you have a source that's educating you and trustworthy, that applies to your current, situation.
Awesome. Yeah. And that's the thing is, people just go to the internet, but what I find is a lot of times they fail to ask the next question. And it's often the next question that actually, I have an impaction colic, but do you have a temperature? Right. Are the feet warm? Has the horse been drinking? It's the next question, and we're not.
That's why I'm hoping that I think the power of AI to be interactive, because what they say is you can create a digital you. So can the AI that searched all my information, that knows all those things are important to make, can that AI program come back and say, have you checked your horse's fever? What's your horse's capillary refill time? That can actually interact and get you thinking.
With the right questions, yeah.
With the right questions, exactly. Instead of just giving you information, but actually interact just in the same way that I would interact if I was on the phone with the client. Yeah.
All right. Well, you're developing this right now, right?
I am. And I'm actually going to be looking, I'm not sure how long, this is all so far over my head that you can't even imagine, but I'm working with, with some people that are helping me develop it. They're like 12, so they know all this. I look at their videos and I'm thinking, have you graduated from high school yet? Yeah. But they know what they're doing. Yeah. So they're helping me with it. And when I have it ready for beta testing, I'm actually going to be interested in finding some people that maybe, are from different backgrounds and have different activities with horses, and maybe some that are in the holistic thinking and some that are not, to do some beta testing and find out, you know, how we can tweak this to really make it a valuable help for people.
I'm sure we can find people to beta test it for you.
Yeah. So if they'll kind of let you know, or I mean, I don't know if I can give my email out, you know, if people want to contact me, I'm fine to do that if you're okay with it.
Yeah. And I'm just thinking, when you're ready, I can just put it out to my population, both in, you know, social media and my email list, and then I can contact you directly. Cause I think if we tell them now before you're ready,
it's not time yet. It's
right.
Not,
so when you're ready, when you are ready,
it's still a dream in process.
Yeah. You'll let me know. And maybe what we'll do is we'll just do a whole webinar on it.
Okay. All right. That sounds good. Because I want people that are new to horses, people that have 10 horses, people that have 1 horse, people that compete. I want to see, you know.
Yeah. You need a broad
to make this useful. Right.
Exactly. To test it out and make sure it works. That'd be awesome.
Okay. Super.
Well, Madalyn, we're almost at an hour and a half, and I think it's getting time for people to go have dinner or whatever, depending on their time zone.
The one thing we didn't touch on is one of the questions about vet techs.
Oh, okay.
I'm all for vet techs, but I also think that some of these veterinarians that are in an internship program could also be coming to the farm and doing some routine procedures, even though they're not a fully qualified vet, but they're that in between, that they're in training. But yeah, I think utilizing vet techs, utilizing interns, there's just, all of that needs to be in the model.
Awesome.
Absolutely.
Awesome.
All right.
All right. Well, thank you so much for coming back. And, you know, like, it's just been incredible, and it's such an important topic. So I really appreciate you taking the time to share your knowledge and information. And certainly what you're proposing is really helpful, because, you know, we out here in the, you know, non-veterinary world, we don't really know what's going on in the veterinary world in terms of how they're approaching this problem. So it's just really great to hear it from your perspective, because there's so many things that you brought up in these 2 webinars that I hadn't even considered. Yeah, I just know that there's a problem, right? But we don't know, like, the behind the scenes. So that's been really, really helpful.
Yeah, I did not realize it was this bad, you know, until the AAP convention last year. Yeah.
No, I've been hearing it for the past, you know, actually year, but probably the past 6 months, it's been getting louder.
It is.
And I think it's because of the problem is deepening, but
maybe we could actually do something before it hits total crisis level.
Right. Because your suggestions are fantastic. And I think there's, you know, I hope that they seriously take a look at this. And that's why I'm going to encourage everybody to talk to their local vet so we can get this up the food chain and come up with good solutions.
Sounds like a plan.
Right. Thank you so much for joining me. And thank you, everybody. Just let everybody know, all your friends, tell them about this webinar. I'll get it posted up soon. And it's every horse owner should listen to Dr. Ward's discussion on the vet crisis looming in our neighborhood. So take care. Have a wonderful evening. Thanks. Bye.
Bye.